This is part 2 of my Mental Health Awareness Month series, where I'm sharing information about the different types of people and clinicians you will encounter in the mental health space. The purpose of this series is to give you the information you need so that you can make the most informed decisions for your care. Hi, I'm Dr. Iman Hippolyte, a double board certified psychiatrist and therapist with over 20 years of clinical experience, and I not only help high achieving women overcome high functioning depression, anxiety, and burnout, I also help high achieving women shift from grinding to thriving. So a quick sec for a little housekeeping. I was mistaken when I said that this would be a 3-part series. It's longer because this topic requires room to breathe and is far too complex and important to be condensed. Now, before I begin, I'm going to share this disclaimer. Hear me out. These are generalizations I'm sharing about people and clinicians you may encounter in the mental health space. It is by no means rule of law. Of course, there are exceptions to what I'll be saying, and of course, there are both good and bad apples in the field, as there are in any field. And lastly, this is not about the inherent value of one person and their work over another. So with that said, let's get into defining the different roles you will find in the mental health space. Mental health influencers. They can be effective sources of peer support, meaning they can speak about mental health based on their lived experience, meaning their experiences are their source of expertise. But most have no formal clinical training, so they do not have clinical expertise. If you are getting mental health advice from an influencer, understand that there are inherent risks and limitations of doing so. And if you're experiencing symptoms that are impacting your quality of life or how you're showing up day to day, or definitely if they're impacting safety, consider reaching out to a licensed clinician for support instead. Now, if you are working with a coach, it is important to be clear about what experiences and training they are drawing from to coach you. It is important to understand that personal and career development and mental health care are not the same things. If your needs are more within the realm of mental health, understand that coaches are not qualified to provide mental health care unless they're also clinicians. And if they are a clinician who is acting as your coach, there are boundaries about what types of concerns should be addressed in a coaching versus clinical relationship, and that should be clearly disclosed to you. Now, in the next part, I'm going to walk you through the doctoral level clinicians, meaning the clinicians with doctor in front of their name. And I'm going to explain what their training actually consists of and what that means for your care. Stay tuned. Bye for now.